Hello, so I just started a new class today. Just going to read through some of the introduction stuff that we were given. So, introduction. As you may know, the American Psychiatric Association, APA, just released a newer version of the diagnostic and treatment tool known as the DSM-5. We're going to begin with a little history lesson. Creation of the DSM. 1801. Pinel noted melancholia, mania, delirium, dementia, and idiotism. In 902, Kraepelin noted infectious and intoxicated psychosis, differential in schizophrenia from mania, identified Alzheimer's, paranoia, and psychopath. Treatment was water, leeching, bleeding, and chaining. In 1917, American Medico-Psychology Association noted for schizophrenia, mania and depressive disorder, paranoia, functional psychosis, and neurosis. 1952. American Psychiatric Association released the DSM-1 with 60 diagnoses. In 1968, APA DSM-2, so I'm guessing that's when the DSM-2 came out. In 1980, the APA released DSM-3 and added ADD, anorexia, bulimia, autism, panic disorder, PTSD, and deleted homosexuality. And then in 1987, the DSM-3R came out. In 1994, DSM-4. 2000, the DSM-4-TR. In 2013, DSM-5. And then in 2022, DSM-5-TR. I have the 2013. I don't have the TR version. So, one must wonder about the science of diagnosing. So 4 versus 5. Here's the long and short of it. Significant evolutionary items with this version. Let's look at a few of them. Elimination of Roman numerals. The order is birth to death in each chapter. No GAF score. Severity rating scales to measure better or worse. New emphasis on culturally informed assessments. CFI cultural formulation interviews. Many tools are emerging at a cost. Axis 4, known as the psychosocial stressors, is now other conditions that may be focus of clinical attention, include medical conditions. No more axis 2 or 3. In fact, no more axes, just listed all together. And WHO Disability Assessment Scale on page 747 in the big book. So I have that. Continuation from the last page. So 9, rating level of impairment is 0 to 5 for each diagnosis. No more gender identity disorder. ADHD can only be diagnosed from ages 7 to 12. No more subtypes of schizophrenia. Dysthymia is persistent depressive disorder. Chapter 3 has assessment measurement scales to be used by credentialed individuals. They are intended to determine recovery progress or not. NOS is replaced with NEC, which cannot be carried for more than 3 months. And continue need to be cultural sensitive because 5 does not do that. I know there are more that we will need to discover ourselves. Implications. In theory, clinicians will have 2 years to totally switch to the DSM-5. However, insurance companies may be forced to switch faster, causing a ripple effect. Therefore, you will see numerous trainings throughout the year to prepare folks. However, there is another political movement affecting treatment, and that is license of practitioners. Please ask if you are interested in hearing the most recent. This is changing weekly. And then we have intellectual disability, once known as mental retardation. This process has been going on for years. The term mental retardation has been offensive and no political correctness. In fact, the federal government then Maine changed its name long before the book was released. Another significant change to mention here is the elimination of solely based on IQ results. The severity of mild, moderate, severe, and profound similar to previous, but with more complexity with domains to conceptual, social, and practical. The end result is the diagnosis is based on clinical assessment and standardized testing that includes intellectual and adaptive functioning. Definition of mental disorder. Emphasis on mental disorder as a health condition. Replace clinically significant behavioral or psychosocial syndrome to significant dysfunction in an individual's cognitive, emotions, or behaviors. A significant increased risk of suffering death, pain, disability, or an important loss of freedom. Some disorders may not be diagnosable until they have caused clinically significant distress or impairment or performance. Change in thinking this time around. Constructing a diagnostic classification system is a way of finding order for the otherwise complex, intricate, and unorderable phenomenon of psychopathology. It also helps communicate, select effective interventions, predict course and prognosis, and differentiate between disorders and non-disorders. A categorical diagnosis has only two values, the presence or absence of a disorder. Dimensional assessments are rating scales that measure frequency, duration, severity, or other characteristics of a disorder. The assessment provides additional information with diagnosis, treatment planning, and treatment monitoring. In addition, the DSM-5 task force is also proposing cross-cutting assessments to measure diagnostic symptoms commonly seen in clients, regardless of their presenting problem or subsequent diagnosis. The assessment is used during an initial clinical interview to measure symptoms commonly seen and monitored in most clients, regardless of their initial presenting problems or diagnosis. That's a tongue twister. Okay. I hope that was clear. If not, give a minute to pause. I will get something to drink. Much better. Okay. Cross-cutting symptom assessment. Assessment of areas that are relevant and most often cross-cut regardless of specific category. Depressed mood, anxiety, substance use, sleep problems, anger, and I think they left out suicide. Designed to establish a baseline for overall health and allow tracking of progress. Usually a single page like PHQ used in level format. 0 to 4 scale is encouraged. There are many free scales, Promise and Health and Mini. Suicide risk factors, history, previous attempt or prior mental illness, family history, that kind of stuff is what they're getting for suicide risk factors.